Hello, I'm Dr. Sandhya Nana from Johannesburg, South Africa, and today I'd like to take you through the macrovascular complications of diabetes. Now, this is Mrs. M, who has just left her GP practice after being told that she has been diagnosed with type 2 diabetes mellitus. She's been told that she needs to watch her diet, start exercising, stop smoking, and try to maintain her glucose levels to normal levels. And if she does this, then she will be able to prevent the long-term complications of diabetes. And this is exactly how she feels: shocked, anxious, overwhelmed, a bit of guilt, self-blame, and her life almost takes on a new reality. Statistics from 2015 show that 415 million people were living with diabetes. But what's shocking is that by the year 2040, this figure is going to escalate to 642 million. And what's even more overwhelming is that 193 million people are currently unaware that they have the disease, and unfortunately, this predisposes them to the complications. Now, what exactly is diabetes? It is a metabolic disorder that is characterized by high glucose levels. These high glucose levels are caused either by an increase in insulin secretion, the action of insulin, or a combination of the two. Most people present with a bit of weight loss, blurred vision, feeling thirsty, frequent urination, poor wound healing, and these are symptoms that people usually experience when diabetes develops. The complications of diabetes can be divided into macrovascular and microvascular complications. Microvascular complications refer to complications that affect the small blood vessels in your body, and macrovascular complications affect the large blood vessels in your body. Macrovascular complications usually cause stroke, heart disease and hypertension, and peripheral vascular disease, and I will go through each of these. Now, what is atherosclerosis? Atherosclerosis is basically the hardening and narrowing of arteries. Now, in this figure, you can see what a normal artery looks like. And the figure at the bottom basically shows one in which atherosclerosis has begun developing. And you see plaque formation on the inside of the lining of the artery. And you can see it very nicely in the cross section, where that's what a normal artery looks like. And once you have this plaque being formed, you can see your artery is now much more narrow. And what this narrowing does is that it decreases blood supply to specific. If the blood supply to your brain is decreased, then you'll suffer from what is known as a stroke or a brain attack. People usually present with weakness on one side of the body, confusion, trouble speaking, slurred speech, double vision. And diabetics are at a 2 to 4% increased risk of developing stroke. And what's also interesting is that they usually have worse neurological symptoms as well as an increased rate of death. Now, I know these pictures look very gross, but this is the end result of peripheral artery disease, which is decreased blood supply to the lower limbs of your body. And diabetics are at a 15 times increased risk of developing this. One of the earliest symptoms that people develop is called intermittent claudication, which is pain that is usually felt in the calf muscles on walking or physical activity, and this pain usually reduces. Cardiovascular disease refers to disease that affects our heart. And the pictures on the right, once again, show what atherosclerosis does. And you can see what a 30% blockage versus a 99% blockage does to those arteries. So once your artery is 99% blocked, your blood supply to that part of your heart is going to be drastically reduced. And this is what causes one to have a heart attack, or in medical terms, a myocardial infarction. Cardiovascular disease is one of the leading causes of death in people with type 1 and type 2 diabetes and results in 70% of deaths in this group of people. Patients usually present with pain in the chest, shortness of breath, and nausea. Now, there are a host of other risk factors that also predispose you to these macrovascular complications. And these other risks are high blood pressure, high cholesterol, smoking, physical inactivity, being overweight, and the diet. The management should be targeted at what I like to call the ABC, which is your HbA1c, your blood pressure, and your cholesterol. Your HbA1c is a blood test that is usually performed by your doctor, and it can either be done as a finger prick test in his room or a blood that is taken and sent to the laboratory. It looks at your average glucose levels over the last 3 months. And the target level for diabetics should be anywhere between 6.5 to 8%. This target is usually individualized and will be decided upon by you and your general practitioner. And your HbA1c should be monitored at least every 6 months or every 3 months. There's a need for it to be. Blood pressure is another parameter that needs to be monitored by yourself and by a general practitioner. It should be monitored at least annually or at every visit that you go to the doctor. Your blood pressure should be monitored. Target blood pressures for the diabetic population is usually below 140/90 or even lower, like 130/80 if you have any other complications. You can achieve this by lifestyle changes, and if this is not adequate, then you will be prescribed medication. Cholesterol is another test that your doctor will perform either as a finger prick test in the room or a blood test that is sent to the laboratory for investigation. The test is usually called a lipogram and measures both your good and bad cholesterol. You can maintain cholesterol levels by lifestyle changes, or once again, if this is not adequate, then medication needs to be. Now, I've mentioned a lot about lifestyle changes. So what are these lifestyle changes that we as individuals or Mrs. M in the beginning of the slide can do? Firstly, we can stop smoking. And there's numerous modalities available out there to help you with this. You need to discuss this with your practitioner, and they may even be able to prescribe medication for you that will assist you to stop smoking. I know recently your e-cigarettes have become very popular, but there's still a lot of debate about whether they are advantageous from a health perspective over your average nicotine. I think this picture depicts so much how our lives have changed from 1960 to 2011. And basically everything these days have been supersized. Our meals have gotten bigger, and that's important. It's not only important that you eat a healthy diet, but it's also important how much of food we consume on a daily basis. And visiting a dietitian often helps in this regard because they teach you how much you should eat, and they can also work with you on your personal choices as well as cultural choices so that the food that you consume is still you still want to eat it. Now this slide really depicts one of my pet hates, which is exercise. It's currently recommended that adults should exercise about 150 minutes a week, and this should be of moderate intensity, and you should do it at least 3 times a week. Children should exercise for about 60 minutes a day. And it's very important that sedentary time is reduced. We are now spending increasing amounts of time in front of tablets, TVs, PlayStations, um, and all of this obviously has huge negative effects on activity. And then watching your weight. If you are overweight, a 5% reduction in body weight will definitely improve your glucose control. And women should consume between 1,200 to 1,500 kilocalories a day, and males between 1,500 to 1,800 kilocalories a day. And once again, visiting your dietitian may help you with. So my take-home messages regarding macrovascular complications of diabetes is that they definitely do exist, but they can be prevented with appropriate management, individualized treatment. And it's important to realize that you need to take little steps every single day, and you don't need to do this alone. It needs to be a collaborative effort with yourself, your healthcare practitioner, your family, dietitians, the podiatrist, the cardiologist, and everybody can work together to prevent these long-term complications. Thank you.